Hi there, and good afternoon. Thanks for joining us. I'm Tanya Rivens, and this is Canceling COVID. I appreciate you tuning in. It's a place for real talk and real solutions to stay safe in the middle of the COVID-19 pandemic. And yes, folks, we are still dealing with this now that we have launched in since January. And man, we've been dealing with this since last year. So at some point, we have got to get it under control. Of course, thank you to our sponsors, mecnc.gov. McNC.gov 980-314-9400. If you ever have any questions, don't go to the internet. Go to reliable sources, people that you can trust and know that they'll give you facts, or even your medical provider. And speaking of medical providers, Groundwater Solutions, we're so grateful for their support as well. Dr. Trasha Black will be joining us in just a moment. We'll give out all of her information as well. But we're grateful again. Mecklenburg County Public Health and Groundwater Solutions. Now, thousands of children are sick with COVID-19. Local schools are rethinking their position on masks to slow the virus spread and prevent mass quarantines, which is happening all around us. And believe it or not, some places are still offering it as an option. Both Iredell, Statesville, and Catawba County schools voted last night to require masks. Good for them. Now that at least 10% of the student body is in quarantine. And folks, we've seen how our students fell behind as a result of this pandemic. We can't afford to do it another year. So put all politics aside and let's just do what's best for our kids. They're our future, and we've got to rethink what really works, what's going to benefit our students. Now, Union County, that's a different story. They've got more than 5,000 students quarantined. 5,000. That's a whole bunch of kids that are quarantined. And after nearly a 4-hour meeting, the school board still voted 5-4 to not require masks last night. Now, you think on that for a minute, and what could they possibly be thinking? What really impacted their decisions? Wow. 5-4. It was close. 4 hours. You really had to take that long to talk about it. And again, we're talking about what's best for our students. Keep in mind, districts now have the power to switch to virtual learning to contain COVID. So I'd love for you to weigh in. I see you hopping on as usual. I appreciate it. I've got some real loyal and faithfuls. Good afternoon, Frederick Love. I appreciate you. Also, I want you to weigh in on this question. Do you think local schools will temporarily be remote? I'm hoping not, because our students struggle so badly. Did you see those test scores for CMS? Well, here's the deal. Think of what benefits our children. So, do you think local schools will temporarily be remote? I'd love for you to jump in the chat and share your comments and just let me know how you feel, especially if you've got students in school. It's a real struggle because it's kind of like back and forth, back and forth. And you, meantime, as parents, you're trying to maintain and do what you need to do to run a household and raise your family. So that's quite a struggle. We've got some special guests, as usual, that will join us. Again, the question of the day: do you think we're almost to the point where North Carolina public schools will begin switching to virtual learning to contain COVID? Hoping that's not going to happen. We've got a guest with Johnson C. Smith. Hopefully, we'll get her on to talk about the adjustments that they've had to make as well. But now that we've got Dr. Trasha Black, I mentioned her Groundwater Solutions. She's here and ready to come on. I'm so honored, always glad to talk with her. And of course, I appreciate you dropping knowledge, sharing wisdom, all the work that you do out in the community. Why don't you weigh in on this question of the day to get started? Do you think we're getting closer to where districts are going to have to switch to remote learning temporarily to kind of contain what's happening?
Tanya, I think if I was going purely on logic, I would say absolutely that we are probably going in that direction. But when I hear things like what you talked about with Union County and
Yeah,
the decisions that they made, I think the politicians and elected officials are not necessarily going on logic. So to have a 4-hour discussion, that many young people who are quarantined, which probably means their parents are quarantined as well and can't go to work, then
right.
we are not operating based on logic. I think that publicly we have dug our heels in the sand and said, we're not going backwards. We're not going to bring back mandates like masks and things. And you
Right.
see it in certain pockets, but across the board, the message is get vaccinated so that life can return to normal. And they're not going for anything else. Anything that looks like a backward step, they are not willing to do it, even if we are all sacrificed.
Wow. And I was like thinking that parents would really look at what's best for their children. And one of the counties, when they voted to give, the leadership wanted mask. At least, excuse me, that's what they shared. But
Mhm,
when the parents voted to make that mask the option, and I shared this before, the leadership said, well, clearly they understand that they are taking a chance that they will have their children no longer in school, and they're willing
mhm.
to accept that. But the fact that someone would even feel that way at the expense of their children is quite disturbing to me. And
Well,
so
I
it's
think
hard for me.
there are two camps. You've got
Okay.
the camp of folks who are vaccinated, fully vaccinated. They may have adolescents who are fully vaccinated who believe, look, we've done our part. We don't
Mhm.
have to be restricted by mask anymore. And then you
Okay.
have this whole other set who believe COVID is this pandemic, and it may or may not be real.
Yeah.
I'm protected without a mask, and you've got these two polar opposites that are both putting pressure on the folks who are in leadership, and they're trying to make everybody happy, and
Right.
instead of just doing what we know to be best, what we know promotes safety.
Yeah, and it's really, really tough on them, really tough,
Yeah.
to make these decisions. So let's say, how concerned are you? We just came out of the holiday, post Labor
Hmm.
Day, and
Hmm.
just before the holiday, more than 1,000 people were being treated for COVID in Charlotte hospitals. And Lord, if you can stay healthy right now, please do. The
Hmm.
hospital beds are full. So for me, I have to make sure I'll trip in a moment. I'm not putting that out there, but I know my husband will tell you, you don't want to be in a situation because we've got so many people right now being treated for COVID. So we come
Right.
out of Labor Day celebration, a lot of outdoor events. College football season is kicked
Yeah.
off, NFL season, preseason, getting ready to start regular season. Do you think we should be concerned about a spike?
I am concerned, and I know
Okay.
that here in Mecklenburg County, we are preparing. Public health is trying to increase the number of testing sites in our community. We've
Mhm.
been asked to partner with another historically underutilized laboratory to provide mass testing and to
Mhm.
be ready by this weekend. So
Oh,
we
I see.
are mobilizing. I think we should all be ready, unfortunately, because I've been out and I say it frequently that usually my cousin and I went to an event last night and we looked around the room and we were the only people in masks.
Oh,
Again, it's the whole
inside.
safety issue, and it's just like I want to take people and kind of shake them and say, what don't you understand about
Yeah.
where we are in our history right now? And so the fact that we are all there, and it's psychological, we want
Yeah.
to be past this and we're not, but because we're behaving like we're not, we're going to see those spikes. We
Wow.
anticipate it. I'll say for the last couple of weeks, our numbers in our testing and in our laboratory, they are going higher and higher daily. And I'm delivering positive results to lots and lots of children. Yesterday, I delivered a positive result for a 6-month-old,
Oh.
and and the mom is actually negative. She's
Mhm.
vaccinated. She said, I'm negative, but her mother and her child, school age child and infant, are positive. So
Wow.
yeah.
Yeah, that's a tough one. So the director of the World Health Organization now says he doesn't believe we will eliminate or eradicate COVID since it continues to mutate very much like the flu. Now, what in the world? I know World
Mm.
Health Organization is saying this, but we've got to figure out a way to not really, I guess, not eradicate it, but manage it
And
better.
manage it. We need to do a better
Yeah.
job in managing it. And I've,
Okay.
I've said for a long time that I thought it would be a long time before we have it fully under control. But
Uh-huh.
that's never going to happen unless we make some very hard decisions as a community. That means protecting everybody, those again who choose to be vaccinated and those
Mhm.
who don't. We need to have a safety strategy for the entire community, and we will then be able to manage COVID-19. But as long as we have that dividing line, we're going
Yeah.
to be struggling with this however long it takes us for the light bulb moment to go off to say we need a community wide strategy.
Well, are you seeing any trends or anything that you're watching closely? You just mentioned you're getting ready to partner with an underused
Hmm.
lab.
Hmm.
What else is happening out there?
Well, like I said, I think the testing numbers are going to go back up. We're going to see
Mm.
those lines potentially again that we saw in 2020. I think we're seeing numbers go up in facilities. We already know the schools. We're also seeing numbers go up in the jails and prisons here in North Carolina.
Wow.
We've been inside a jail and had to test inmates through the bars. It's not a pretty situation in there. And I'm reading on the public health website that in the 55 prisons, we're seeing the numbers go up to quarantines, isolations, and they have limited space. So I'm definitely concerned for those men and women who are in those facilities, as well as the correction officers. Just wherever people are congregating and there is not social distancing, there is not masking, there is not good hygiene, we are seeing those numbers skyrocket.
And that's really an atrocity right there because it's tough enough being incarcerated. And yes, I get it. They
Hmm.
are there for committing a crime. But,
Hmm.
we had a dress rehearsal with this last year. And
Hmm.
so all those kinks should have been worked out because
Hmm.
people did transition inside those walls. And I'm talking about jails and prisons.
Right.
And officers lost their lives as well.
Hmm.
So to turn around and repeat when you got a targeted audience there and all the funding that was
Hmm.
provided, someone should have stepped up and made sure this next go around some improvements were made. So that
Right.
really bothers
And
me.
we should have been consistent. I think,
Right.
we're early on in 2020, we were very determined and specific in the strategies that we put in place. I believe that those strategies have been lessened because we
Mm,
thought it was over. We thought we had it. It was taken care of, and those were relaxed. And now they're having to really jump through a lot of hoops to put those strategies back in place. Um, the numbers are still high again. I think there's limited space. In one
right.
of the facilities we went into, they were the ones who were positive. I don't even want the backlash for what I'm about to say, but the people who were positive were in this part of the jail it smelled like animals. It was
Mm,
probably not fit for human habitation, but that's
mm,
what they have in order to keep the other
mm,
folks who are testing negative safe. They've got to
right.
put them in places that they probably would otherwise not. So it's just not a good situation. And I don't know what the answers are in the correction side, but I know if we can use them as a model, because in that tight space, you're going to see kind of the worst of COVID-19. That's the
Right.
scary part. We're going to see the worst inside the facilities, but it's transferable information of what we need to be doing on the outside as
Well,
well.
one of the things ACLU and NAACP had sued the governor or the state to release some of these guys, especially if they were getting close to their release date or
Hmm.
if they had family or if it was for age for various reasons. And
Hmm.
I don't know if it was paused, but I know they all have not been released. So that might be
Right.
one
I think
solution.
it was paused because
Right.
I think they thought we had it under control. We don't
Right.
need to do that. The emergency has passed, but we are
Right.
entering a new phase of emergency across the state, across the country, and we're going to have to take those same rigid precautions that we did in 2020. We need to resume them immediately without delay, and that's the message for the school system as well. We're going to have to take those same precautions because we're seeing the same types of numbers.
Well, I just have to say one more thing. It breaks my heart to hear you share that because, I work very closely with those that are incarcerated and looking for a second chance and trying to give them hope.
Mhm,
And they have to, be inside under those circumstances because people who have been put in charge,
mhm,
placed in charge to care for you, and they've been paid to do it.
mhm.
It's just that. And I get the restrictions, but I don't get not managing it in a better way.
Yeah, I want to say one thing about that too. When we got there, they asked if we would talk to the folks who were there about the vaccine. And
Yes.
when we first started talking, they didn't want to hear about it. I'm not taking that vaccine. I'm not doing this, and I'm not
Right,
doing that.
right.
And I told them that my job here is not to convince you to take the vaccine. My job is to answer questions, to tell you pros, cons. What to find out what you've
Educate.
heard. Yeah, again, the dialogue. I think the
Right.
dialogue is what will get us moving as a community. And I think there were probably 120 folks who were not vaccinated. I probably talked to about 40 of the folks one on one myself. We
Oh,
talked about, my concern is if you're out here in the world and you're not getting vaccinated, then again, I can tell you, make sure you're wearing your mask, practice hygiene, social
right.
distance. I said, that's what I tell you. If you're choosing not to take the vaccine, I said, but as I look around this facility, you can't do any of those things.
No.
They control whether or not they provide you a mask. They control who you're going to be in the cell with. And for the
Mhm.
most part, there were 3, 4 people in each cell.
Ooh,
And they got to give you the things to do the hygiene, wiping things off before you use them, washing your hands. I said, you have no control of your ability to be safe here.
wow.
And of the 40 people I talked to, about half decided on the spot, I'll take the vaccine.
Well,
So
praise for
it was a
that.
real conversation. We
Yeah.
talked about side effects, and I was honest. I said, we don't necessarily know. And I
Mhm.
and I'm going to tell you, I don't know what the long-term effects are, but I do know that there is strong evidence that it will keep you alive during COVID-19. And they
Good.
selected to take the vaccine, even though the administrator said, "Oh, we've been talking to them for the last 9 months. They're not going to take it." Those men and women took the vaccine.
Well, I am grateful that you did that, and I'm sure saved some lives, which has got to be quite gratifying. But that's what you do, grassroots, working in community. So thank you so much.
Mhm.
Now, where you guys out today? I know you're out somewhere.
Woodland Daycare providing vaccines and testing today. We're also at our main office, 5104 Reagan Drive. You can call us at 704-596-0505 to be tested or to be vaccinated. You do not even have to get out of your car. Starting within the next 3 to 5 days, I anticipate we're going to have large testing sites around Charlotte, 4 or 5 different locations. So please just, contact us. We're here for you. If you have symptoms, please go get tested.
Absolutely. And that's groundwater-solutions.org, groundwater-solutions.org. And one of the testing sites, September 18th, Groundwater Solutions will be at Praise in the Park, Smithville Park, and Cornelius,
Hey.
testing and providing vaccines. So we're grateful for that support as well. It's at 5 p.m., folks. We hope that you will join us. Pastor John P. Key will be doing a free concert. Any
Mhm.
closing thoughts from you, Dr. Black?
No, just that I love this community, and I am determined that we're going to live through this.
Absolutely. We're going to work together. We've got to
All right.
cancel COVID. So thank you so much for
You're
joining us. So
welcome.
appreciative. Enjoy the rest of your day and keep up the great work. As we continue, we're going to talk more about, I mentioned what's going on with our schools, and one tie in is we start talking and thinking about what's going on with the colleges and universities, and why not check in with one right here in the city. So JCSU, Johnson C. Smith University, they returned their in-person classes for the first time in more than a year, and they ramped up their safety measures. And we can all learn from this. And they are quite a jewel right here in the crown of the Queen City. So I've got Dr. Marian Jones. She's the health director at Johnson C. Smith. Good afternoon, and thank you so much for joining us.
Good afternoon.
Hey,
It's a
Dr.
delight to be here.
Oh, we appreciate that. So let's start with the vaccine requirement for students and staff. How does that work? And if someone chooses not to be vaccinated, are they still allowed on campus, but with regular testing?
The thing is, all students, faculty, and staff were required to get vaccinated,
Okay.
and they have an option exemption for medical or religious reasons. And
Okay.
so, with that in mind, they still have to get tested. The ones that exempt, they have to get tested weekly.
Okay. So regardless of whether they feel like it or not, if they want to be on campus, they have to get vaccinated. Mind you, unless they get the exemptions that are provided. So was there ever, Dr. Jones, a conversation about requiring mask, just
Yes,
requiring the mask? Okay.
we had conversations of whether to require masks. We were trying to follow the guidelines of the CDC, Mecklenburg Health Department, and the
Hmm.
Department of Human Health Services. And so we just came to the conclusion that, we're going to require masks inside the building. So any building you go in, you're required to wear a mask.
So what type of benefits are you seeing right now from just that?
So far, it's been pretty good. We just have to continue to stress to the students to keep your mask over your nose, because they
Yeah.
like to wear it under their nose or under their chin. But anytime they come in the health center, we say put it over your nose, and we have masks at the door, so when they come in, they can get one. So it's
Yeah.
been working pretty good.
So no excuses. Oh, I forgot my mask. I don't have one. And that's great to provide them. I understand that's happening in CMS as well. When the kids get off the bus, they're meeting them. And if they don't have masks, then they're providing them for them. I'm just curious, did the decision, your decision, the school's decision rather, to require the vaccine, did you all have a drop in enrollment as a result? Or are you able to answer that?
No, I don't know. I don't think we did, but
Okay.
several students, they agreed to it because the majority of them are vaccinated.
Right.
Um, our students are vaccinated more than exempt.
Good, good. Are you all taking any other steps for mass to avoid these mass quarantines that we see breaking out in some of the schools?
The thing that we're doing is when the student was in came to college, we gave them a duffel bag that had a mask bag in it that had
Okay,
a thermometer, it had 2 masks, hand sanitizer, and direction as to what you need to do for us being safe with masks. So we
that's
offer
very
that to all our students.
so that's some great pre-planning to make sure that you can control. And my guess is you got some sanitation stations all around campus as well.
We do. We have hand sanitizers, and like I said, most places have masks available for students. And we gave them 2 masks, so they have masks to let them know this is what we mean to wear your mask when you're
Yeah.
inside the building.
So Dr. Jones at Johnson C. Smith University is joining us on canceling COVID. We're grateful for her time. What is the protocol if one of your students by chance happens to get exposed to COVID?
Well, if they get exposed, the first question we ask them, are you vaccinated? And then if they say no, if they say they was exposed, we tell them you need to quarantine. And then you quarantine, you get tested in 5 to 7 days after being exposed or either have symptoms. But if you're vaccinated, we just tell them that, we need to get tested 3 to 5 days. You just continue to wear your mask.
Wow. Well, here in North Carolina, we had more than 25,000 new cases reported, 6 times what was reported Labor Day of last year. So obviously, we all are aware that the numbers are spiking. But one of the things that we are trying to also keep in the dialogue is about the students' mental health and the impact that it's having. How are you guys dealing with that when it comes to health services? Because we know whether it's grief, isolation, financial pressure, all of this is triggering depression and anxiety, not to mention just being a college student. So, what role are you guys playing with that?
We have a counseling center on
Mhm.
campus, which Ms. Tierra Parson is director, and they take care of most of the mental health issues that our students have. And also we have telehealth for our students, which is a
Yeah.
24-hour system that they can access for medical counseling, timeout, or any time of the day if they feel like they need to talk to someone.
Yeah.
If they, we just added that extra for them.
And that's good to know. It's great, great to know that. And shout out to you guys. You guys, Johnson C. Smith is paying off $300,000 in outstanding balances for many students enrolled during COVID pandemic. So salute for that and kudos. That's a big relief for the students. So clearly, you all are taking the steps. Appreciate your new president, Brewster. Hopefully, I pronounced that correctly. He is
You
doing a
did.
wonderful job. Yeah. Is there anything else you would like to add as we wrap things up?
I would just like to say, please get vaccinated and encourage other people to get vaccinated.
And I appreciate that public service announcement because I always tell people that are saying I'm not then I say if we all felt that way, we would not be where we are today. We'd still be on lockdown. So someone has to consider the benefits and talk to their medical provider and just talk it out instead of just flat out not wanting to get information. So thank you, Dr. Jones, for taking the time to talk with us. And thank you all for all the work that you're doing at Johnson C. Smith for our community and for our young people. So enjoy the rest of your afternoon.
All right. Thank you.
Thank you so much. Hey, great stuff inside of your Wednesday. And look, we're on point, staying on time and everything. That's got to be a great feeling as we continue. None of you have weighed in on the question of the day. However, we have a few moments. I'd love to hear from you and your thoughts on the question of the day. In your opinion, do you think that schools in the districts will be headed back to remote learning? I know we have a lot of educators that hop on. I'd love to hear your thoughts and how you feel about that as well. You know, we really thought by now we'd be far away from this debate, this conversation. But what I really love about some of the schools that say, you know, masks will be required, and there's no discussion, there's no debate, there's no going back and forth on any of that. We made this decision, it's final, deal with it. And that's kind of the decision and the path that's going to have to be taken to get this under control. And Dr. Trasha Black just kind of said that as well. She was like, you know, the diplomacy around this right now is just not working. And so I look at people that are on the airplanes and taking flights and are getting fined because they don't want to wear the mask. I don't get it. Why are you flying? You know the rules before you board. Just drive. Get in your pickup truck or get it, or your car, wherever you decide to do. I'm not trying to single anyone out, but just don't fly if you can't abide by the rules. Get on the bus. If you can't abide by the rules, drive your vehicle. You don't really have to make a scene like this. I don't get it. But anyway, the clusters in North Carolina schools have jumped 71% in 1 week. Folks, this is getting really serious and it's kind of dangerous. So we really have to take precautions. Right now, there's at least one confirmed COVID case in 80% of Charlotte Mecklenburg schools. 80%. And someone reported to me last week there's a high school where the coach had COVID and still showed up for work. Come on, we got to do better. We have got to do better because what we're doing is we're really hurting our children. And that's what we should be focusing on. We've lived, we are enjoying, reaping the benefits of some decisions that we've made. Give our children a chance, at least, to become educated. Have you seen those test scores from last year for our students? That's enough right there. It should be enough to move you to say, you know what? Whatever it takes, we've got to do our part. And again, I'm not pushing you and requiring you or saying take the vaccine because I don't do that division stuff. I'm not even interested in being divided. That's the oldest trick in the book. What I'm saying is if you make the decision not to take the vaccine, at least wear your mask, practice the personal hygiene, and do the social distancing. Go back to just ordering everything and bringing it to your home versus going out. But we've got to get a hold on this. And right now, we are going in the wrong direction. Our question of the day, I don't see you weighing in. I'm just really moved by some of the information that's been shared. If you've got a loved one that's incarcerated in North Carolina, reach out to them. You'll probably have to write. Oftentimes, when we see these pandemics, let me not say often, because this is the first one that I've lived through. But I know last year with the pandemic, there were a lot of the facilities that were on lockdown. Family members didn't have an opportunity to even get phone calls because of the limits that were in place. But check on your loved one. Just check on them and make sure that they're okay. And if they're not, ask questions. It's really that important because it's tough enough that they're incarcerated. And to be in the conditions that they're in is quite troubling. And it should be troubling to everyone because, people make mistakes. I'm going to wrap things up. I still don't see you hopping in the chat, but this conversation continues. And the way that happens is I need for you to share this conversation. Make sure that people know that we're here as we continue to look for ways to grow people to tune in because we provide great information that allows you to make decisions as you continue on. Again, thank you to Mecklenburg County Public Health, mecnc.gov for supporting canceling COVID, recognizing that grassroots is another way of getting the message to the community. And of course, Groundwater Solutions, we're grateful for them as well. They will be in Cornelius again on September 18th. So we are about 10 days away exactly for a Praise in the Park event, and testing and vaccines will be provided there, along with vendors and food and great music with Pastor John P. Key. But make plans to join us. It's in the evening at 5 p.m. So you have some time to do what you need to do on your Saturday and then come out and join us. I'll see you back here on Friday. We've got another great conversation coming up. We want to continue focusing on what's important in our community and what's relevant right now. And if you have some suggestions, you can email me, TanyaRivens@AOL.com. TanyaRivens@AOL.com. Okay, family, my time's up. As always, life's challenges make you better, not bitter. Have a great day. If we have more thunderstorms rolling through this afternoon, make sure you stay dry, be prepared, and keep in mind together, we can do this together. We plan on canceling COVID. Thanks, everyone.